folks, shocking statistics. I'm not excited about it, but I got to share it with you because it shook me to the core and it really reinforced what I'm doing. My wife and I are doing at RX Healthy Habits. 1 out of 3 Americans are pre-diabetic. 8 out of 10 of them don't know that they have this diagnosis. And you're saying, I never heard of the diagnosis of prediabetes. Well, you will, because let me tell you, right now, I'm been researching the CDC and what they're doing, and they have a lot of good things coming that can really help mitigate, prevent, or maybe reverse this whole process. And that's what I'm excited about. And my wife and I, RX Healthy Habits, we're right on board with this because we want to make a difference as pharmacists. So I'm going to go through and tell you some good news. And I just gave you the bad news, but let me tell you the good news. With lifestyle modification of dietary restriction and physical activity increase, if you can drop your weight sometimes just a small amount, it's going to make a huge difference in preventing this disease state, which is called type 2 diabetes. From pre-diabetes, you go into type 2 diabetes. And we have a lot of information already on our website that can do it. But the CDC has a program out there. It's called the Lifestyle Change Program, and you can become, I'm considering becoming a coach on this, because if I can help somebody over the course of a year change some of the things they're doing, they can really eliminate the need for them to become type 2 diabetic. So let's go through real quick. I'm not going to take a lot of time to unpack all this, but I'm going to come back to this, and we're going to talk about how your doctor can diagnose if you have prediabetes. First of all, diabetes, what is it? There's type 1. Type 1 is an autoimmune dysfunction where your body destroys your islet cells in your pancreas, which means you can no longer produce insulin. You are insulin dependent the rest of your life. There's no cure, unfortunately. There's just treatment. I can speak with authority on this. I have a son. My oldest son is type 1 diabetic, and my 2 grandchildren are type 1 diabetics. Nothing they did on their own. Nothing they did with their diet. They just got struck with an autoimmune disease, which means the body destroyed its own cells. Why does it do that? Why does arthritis happen? We're trying to understand that. It's very complex. Someday, there will be a cure for this. And I'm so excited to know that maybe in my lifetime I'll see it. Type 2 diabetes is much different. That's where your body just doesn't use insulin well, so that then your blood sugar start to rise because it's really not bringing the glucose into your cells. The insulin is over. It just cannot keep up. There's not been enough being produced, but it's more in that the cells become desensitized. So type 2 diabetes is a gradual onset. That's why people with pre-diabetic don't even know they're diabetic. Some people are type 2 diabetics, and they don't even know they're diabetic yet. They're already there. So I guess the numbers are pretty high. There's 5 out of 10 don't know it. Crazy. So we're doing better about finding people that are diabetic. But here's the thing. I want to go through, and I'll unpack type 1 and type 2 in another video if we have time. But right now, I just want to go through and not take a lot of time to unpack this. How your doctor can diagnose if you have prediabetes. I would start going to the CDC website on diabetes, and I would do the quiz and see what your rate is. I did the quiz. I come out at a 70%, which means I failed to be a pre-diabetic, but it said in your lifetime, you're very close. Now, I'm going to go through the criteria, and you know why I probably got such a score that I was surprised at. Not considered pre-diabetes, but I was close. And you might want to go on there. You might take this quiz. It's so important. But your doctor is going to have to do the final diagnosis. So here we go. Signs and symptoms. There is none. Type 2 diabetes has symptoms. Type 1, my gosh, that's so drastic with type 1, the symptoms. Type 2, you'll start to see some things with thirst, frequent urination, dizzy, lightheaded, not feeling good, sluggish, more infection because of the diabetes. That's a slower onset. It usually occurs later in life, but it usually occurs after somebody's been pre-diabetic for a while. All right. So signs and symptoms, there isn't any. That's the challenge. Here's the high risk criteria. And if you got some of these risk factors, you're probably going to score pretty high on that quiz. But also, you really should talk to your doctor if some of these things are already in place. And your doctor should be on top of this. He should be screening for prediabetes. I hope he is. High risk criterion, being overweight. Anything above a BMI of 25 puts you in the category of being possibly pre-diabetic. Overweight, obesity, forget it. Anything over 30 BMI definitely puts you there, maybe in a type 2 already. Being over 45 years of age. Okay, that's what it got me. I'm 62. So, obviously that's going to put you in that range of possibly having a risk factor. No, not possibly, for sure. Now, the next one is having a parent, brother, or sister with type 2 diabetes. Yes, my mother had type 2 diabetes, but because she kept her weight under control, it was very well managed her whole life, which was amazing. But she also had 8 children and worked very hard and never got overweight until much later in her life. So being physically active less than 3 days per week. So here's something interesting. I'm not going to go through how much, but it's got to be moderate. exercise minimally 3 times a week. If you're less than that, there's a check mark for pre-diabetes. If you ever had gestational diabetes, which means when you're pregnant as a female and the doc says, hey, you got some blood sugar things that are elevated here. Polycystic ovary disease in females too is another thing. But in men, typically, many times this is just a risk factor in itself because men usually don't seek medical help. So if you're a guy, you probably got a risk factor right there. Males. Race, ethnicity are huge factors. We're not sure why. A lot of it's probably genetic, but there's other factors. Mostly genetic, though. African Americans, Hispanic, Latino, American Indians, Pacific Islanders, and some Asian Americans are at high risk. So I'm sure they're going to unpack why that is. Let's go through the next thing. This is what your doctor has to do. If you come up with a higher score, he should really be doing an A1C level. If you have an A1C that's 5.7 or below, you're okay. But if it's 5.7 to 6.4, you are pre-diabetic. And they can dial that in with just a simple blood test they do in the office. Fasting blood sugar, they want it to be below 99. If you're running 100 to 125, you're pre-diabetic. Anything over that, you're probably already type 2. Glucose tolerance test, where you drink some of that stuff after you fasted all night, and they check your blood sugar. If you're 140 or 199, you have pre-diabetes. So these are things they can do to make sure that you're not, pre-diabetic, because once you get to the pre-diabetic, it's going to take a little bit of a tipping point to put you over. Probably more weight and more age. You're there to type 2 diabetes, and you don't want to be there. The co-pays for type 2 diabetes as a pharmacist are brutal. I know some patients start out with 1 or 2 meds. In 6 months to a year, they're on 5, and sometimes they're on 7 before it's all done. It is horrible. Your risk factor for cardiovascular events like heart attacks, strokes, cancer, all elevate when your blood sugars get up and you're type 2 diabetic. Everything. Your kidney function is a concern, retinal damage. So anyway, I don't want to belabor it. All I'm going to say to you is find out, check it out. Are you pre-diabetic? I hope not. But chances are, if 1 out of 3 or 95 million Americans already are, you really need to look into it.